Started then. Good afternoon to everyone and welcome to Public Health's virtual education series, Wazooki Woehi, Family Conversations. I'm Ronelle, public health nurse, joined by Jamie Decorah, public health worker supervisor, who will help me moderate today's session. The goal of this series is to gather, learn, and share about Ho-Chunk culture, resources, services, and the connection to health. In public health, we focus on prevention, promotion, and the protection of the health and well-being of our communities. Health and well-being are rooted in many aspects of our lives, from our physical body, our mental health, our spirit, the environment we live in, and much more. During these sessions, we will explore topics that can impact our health and well-being. Together, we will learn about tools and resources to improve our health and the health of our communities. Today, we are celebrating National Public Health Week. Jamie and I have been with you for over a year and a half now, so it's about time we tell you a little bit about what we do outside of this series and what all of us in Public Health Division do. We have most of our team online today to share about their programs and their roles within the Division of Public Health. And if you follow us on Facebook, you may have seen some of our National Public Health Week engagement posts. If you comment on the posts on Facebook with the daily prompt, you will be entered into a chance to win a prize. Today's engagement piece is attending this session. So all attendees today will get entered for a chance to win a prize. As usual, we will have about 45 minutes for the presentation, followed by Q&A. Please use the chat function to enter any comments or questions. The team will monitor the chat throughout the presentation, and you can come off mute at any time to ask any questions or offer comments. If there are any questions we don't have time for, we will respond to the team and send back to the group. This session is recorded and will be posted on the Department of Health website and Facebook page. So without further ado, ready, set, action. Next slide, please. Thank you. So thinking back to the introduction that Jamie and I do for every episode. Okay. So thinking back to the introduction that Jamie and I do for every episode of Wazooki Woehi, public health focuses on prevention, promotion, and the protection of the health and wellness of our communities. Large picture, public health looks a little different for every organization. There is local county public health, for example, Jackson County Public Health, or state public health, like the Wisconsin Department of Health Services. And then there's also organizations like the Wisconsin Association of Local Health Departments and Businesses and Badger Bay that advocate for and lobby for policy change at the state and local level. No matter the organization, the goal is to create healthier communities, and this is done in several different ways, such as community programs, health education, and social media or the news, immunization clinics, communicable disease tracking investigations, and much more. Next slide, please. So what does public health look like for the Ho-Chunk Nation? Well, our mission at Ho-Chunk Public Health is to improve the health and well-being of Ho-Chunk and other tribal members and employees of the nation. We focus on preventing illness and injury. This includes contact tracing, safe sleep program, car seat distribution, and education. We promote wellness by honoring traditional Ho-Chunk ways. And we know that a sense of belonging and community is a protective factor in not only your physical health, but your mental and spiritual health as well. We promote wellness through community awareness, such as this series, Wazooki Woehi, our summer block parties, suicide prevention events, alcohol awareness events, and much more. And lastly, we protect our communities by looking at data trends in our community and then sharing that health data with our communities and ensuring that our people have access to the care that they need. And care doesn't always look like going to a clinic to see a doctor, but it could be looking at housing situations, finding access to affordable and healthy food options, and really knowing how to connect our people with the resources in their own communities. Every community looks a little different and has different needs and different resources. So having the staff on board that knows those resources is key for our community and being able to help our community. Next slide.
Good afternoon, everyone. So when you look at public health team, it's not just titles, it's how we show up for our people. We have leadership of nurses, specialists, and public health workers, but at the end of the day, no matter our titles, we all do the same goal, providing resources and cares to our community, just in different ways. Some of us are behind the scenes planning, some are in the clinics providing holistic care and support to our families, and some are out in the field talking with community members, meeting them where they are. And some are responding to acute outbreaks and contact tracing infectious diseases. In our communities, public health is not just a job, it's relationships. It's being someone people recognize, trust, and feel comfortable coming to when they need help. Next slide. Leadership in public health is really about making sure our people are taken care of and our staff are supported enough to do the work the right way. As you see on the screen, the two leadership people within our public health for the Ho-Chunk Nation are Candace Dunlap, the Director of Public Health, and then myself, Jamie Decorah. I am the Supervisor for the Public Health Workers. Candace and I are always looking at what is actually going on in our communities, not just numbers on paper. We are also listening to what families are dealing with, whether it's mental health, substance use, or just needing more support and resources. Then we figure out how to respond in a way that makes sense for the Ho-Chunk Nation, not just what works somewhere else. We set clear direction, remove barriers, and make sure staff have the tools and support they need. We also listen to what staff are seeing in the community and use that guide in our work. At the end of the day, our role is to support our team so they have all the tools they need to support our communities. Next slide.
So you've all met me many times through this series, but outside of Wazooki Wo'ehi, I work as the communicable disease nurse. And what this means is I work with our providers and providers at other clinics and other health systems to locate individuals with diseases that we call a reportable condition. Next slide, please. So there are a lot of different reportable conditions, but a few more of the common diseases that I often see are things like hepatitis C, sexually transmitted infections, Lyme disease, which we're coming up on tick season. So everyone, make sure you're checking yourselves and your pets for ticks. Also, whooping cough and chickenpox are some of our more common diseases. When someone is diagnosed with one of these diseases, it's then my job to follow up with them, complete a short interview, and try to figure out how or where they may have come in contact with this disease. And then based on that specific disease, it is time to figure out if there are any close contacts or situations where other people need to be notified. And if I've learned anything from this job it's that people are never just sick. They usually need help with something else. And that could be anything like they don't have a place to live right now, or they're struggling with their mental health and they don't know where to go, or kids are struggling in school and they need to figure out how they can get help. So staying connected with not only our health department resources, but other resources in the nation like social services or education or the labor department, but then also resources outside of the tribe. So that could be like the VA or the Alzheimer's Association or local food banks. This is all very important in my communicable disease response to be able to help people beyond just their illness. And then lastly, one of my favorite but also most difficult parts of my role is hosting QPR suicide prevention trainings. I host these both in person and online. I absolutely love this program. It's about an hour-long session where we bust some myths and stigma surrounding suicide and mental health, and we learn some warning signs that somebody may be struggling with thoughts of suicide. And then we practice asking the question of asking someone if they're thinking about killing themselves. And then we figure out ways that we can help that person get the help that they need and keep them safe. At the root of it, it's really just offering hope and help. You know, we live in a world where hate is just one click away. We see all these negative things on social media, online, in the news, but we need to remember to take care of each other and spread love and joy and hope to our friends and family and show them that we care. Next slide, please.
Good afternoon, everyone. My name is Irina Clendening. I'm a public health nurse, maternal child nurse for Ho-Chunk Nation. I work from the Baraboo office, and my colleague Brenda Owen, public health nurse, she works from Black River Falls. In this slide, I will highlight our services. We offer breastfeeding support, prenatal and postnatal education, resources, referrals, parenting workshops, car seat education, again, resources, safe sleep, and Cribs for Kids support. We also offer monthly monitoring for childhood immunization. Next slide. In this slide, I will briefly elaborate on our services. So we offer prenatal and postpartum care coordination with continued breastfeeding support. So families receive guidance before and after birth. Through parenting education, we're strengthening family skills. Our parenting groups give families a chance to share experiences, learn new skills, and connect with one another. Our program promotes wellness, illness prevention, and healthy living by providing practical tools to families, which they can use on an everyday basis. We also focus on child safety, including safe sleep and passenger safety. We educate families on the proper use and installation of the car seat, and we provide cribs along with the safe sleep guidance to the families to reduce the risk of sleep-related infant death. Public health nurse, maternal child health nurses track childhood immunization monthly. We encourage vaccine adherence following CDC guidance and educate caregivers on the benefits of vaccination. All of our programs are culturally aware and guided by traditional values. In short, our maternal child health program supports families at every stage, promoting health, safety, and wellness for mothers and children and the whole family. Thank you.
Hello, good afternoon, everybody. My name is Isaac Yellowbank. I am one of two public health specialists in the Black River Falls area, and super appreciative of the National Public Health Week. I just want to say something real quick. For me, stepping into this public health team within Indian Country is more than a big move for me in this area, and for the nation. You know, it's helping me strengthen my self-sovereignty and assisting in addressing deeply rooted health disparities. For me, it's like the biggest impact coming from health and wellness positions. So yeah, I just wanted to say that much. So we went over the slides here. We have our public health specialists. I'm one of two. Melissa Colbig is the other one. Some of our primary responsibilities is to lead our fabric accreditation, which has been a new task for me. I've never touched it before, and it's been quite the number, but I'm happy I got the team that I have to help me navigate through it. We create healthy communication materials, things you see on Facebook, things we see, flyers rooted around every facility you see, assist in health and education. We manage public health vending machine that you see outside the center here. Next slide, please. Some more of the duties that we do. We help improve community health by bringing people together, building partnerships, and sharing health information. We work on community health priorities by leading community health improvement plan, which we call CHIP groups. Support public health accreditation to ensure best practices are followed. Evaluate programs and events to make sure they are effective and meet community needs. increase access to resources by supporting public health vending machines that provide health supplies and information. This unique position, a little bit more, the unique position allows me to, bridge the gap between high level strategies and real world impact. So I'm really excited and happy to be a part of this crew. So thank you. Next slide.
All right, guys, if you look at the screen, you're going to see all 4 of the public health workers and all the communities that they work in. We have Macy Emery out of Black River Falls, Wendy Lone Tree for Baraboo, Lena Walker for Nakusa, and Claudia Yeager for Wittenberg. Now, the public health workers are the ones out there every day building those real connections within our communities. A lot of the times, they are the first people someone talks to, not because they're doctors, but because they are familiar and present in the communities that they work in. We work with our people through every stage of life, from supporting new parents and young families to staying connected with adults and making sure our elders are cared for and respected. We see people through every stage of their lives, through the good, the hard, and the beautiful chapters, staying present to offer support, resources, and guidance along the way. This is what builds trust and keeps our community strong. We are at times the ears, eyes, hands, and voice of the healthcare system, acting as a vital bridge between our communities and the healthcare needs, ensuring care is not only accessible, but culturally appropriate. Next slide. You'll see on the screen just highlighting a couple of the programs for the public health workers. Our programs are not just services, they are the ways that we stay connected to our communities. Whether it's Safe Sleep, car seats, family spirit, or community events, it's really about showing up and being present. A lot of the times, it's not about handing someone something and moving on. It's about building relationships over time so people know they can come back, ask questions, and get the support that they need. 2 programs we regularly use are Partners in Parenting, or PIP, and our Family Spirit program. PIP is a monthly and in some areas quarterly program that's a parenting class where we bring in presentations, share resources, and create space for real conversations. We focus on topics that reflect what our parents are actually going through, whether that is child development, behavior, mental wellness, or overall family support. It is not just a class, it is a space for parents to connect, learn from each other, and feel supported. Family Spirit is a more in-depth relationship-based program. It is designed to start as early as 28 weeks of gestation and continue through early childhood. We have adapted it to support families with youth of all ages. This program is a one-on-one, often in the home or in a setting comfortable for the family, where we walk with them over time. We provide education, parenting support, goal setting, and connect them to resources while building a strong, trusting relationship. Both of these programs go beyond one-time interactions. They're about long-term support, meeting families where they are and making sure they feel supported every step of the way. Next slide. Now, why does public health matter? Public health matters because it helps keep our people strong. It is not just about preventing illness, it's about supporting our families, our kids, and our future generations. When we do this right, we are not just addressing problems, we are helping our communities stay connected, stay healthy, and continue moving forward in a good way. For the Ho-Chunk Nation, that means supporting our people across all stages of life while honoring our culture, our values, and our responsibility to one another. The work we do helps strengthen families, create healthier environments, and make sure people have access to the support and resources they need before things become a bigger issue. Whether it's going through parenting programs, education, outreach, or community events, we're helping build a stronger, more connected community. When public health is done right, you see the impact over time. You see families doing better, people feeling supported, and communities continuing to move forward in a good way. Next slide.
So we have given you a very high-level overview about what public health is and what we do in our division. Now it's time for the action part of Ready.Set.Action. We have quite a few events coming up this year. Next week, we will have Selena who is a behavioral health clinician in Nakusa and Wittenberg. She will be presenting at Wazooki Wa'ehi next week, and she will be talking to us about Alcohol Awareness Month and sort of prepping us for Sober Prom, which will be taking place at the House of Wellness next week, Saturday. We hope you'll be able to join us for a fun-filled night of dancing, games, and some education. We will be crowning prom king and queen at 8 p.m. So make sure that you show up before 7:30 so you can cast your vote. And then we're looking forward to summer. We are hosting our summer block parties in Wittenberg, Toma, Nakusa, Baraboo, Madison, and Black River Falls. The exact times and locations have not been set yet, but that will come out soon. This year, we're focusing our efforts on a summer of mental wellness. So we look forward to seeing everyone there. Next slide, please. Pinagigi, everybody. We went through that pretty quick, so we have lots of time for any questions. We have a question in the chat. What is one way each of you bring public health into your own lives? I think for me, since I'm already off mute, I have a really good relationship with some of the young people in my life that I can talk to them about harm reduction measures of what safe reproductive practices are and how they can access care in a safe and affordable way.
I'll go next. So when it comes to especially parenting programs like Partners in Parenting, I never bring anything to any community that I didn't want to know as a young parent. I bring lessons, whether that's parenting, nutrition, exercise, but most of all, just the wellness of parents. I remember the self-care portion of it, that we're not just mom, we're not just dad, we're not just students, we're not just employees. You know, we're Jamie, Isaac, Ronelle, Candace. We are people in the end. And remembering that self-care portion of the public health work that we do and bringing it into our communities and reminding people that they're just not mom and dad. You can take time out for yourself and not feel selfish about it.
I can go next too. Hi everyone, Candace, I'm up here. Thinking of like my family and my grandparents, and there's a lot of things to navigate as you age in our healthcare system, but bringing it even one step further in the prevention aspect of it. Sometimes it's just going over for a visit to talk and sitting with and doing quick assessments of what kind of social support do you have, and looking around in my grandpa's house and like what are some fall risks here for things. And so it really, in a lot of everyday interactions with family members specifically, it's not always just voicing it and saying, oh, I'm doing an assessment of prevention right now. It's just bringing those into part of conversations with all of the individuals that I love dearly.
I can go next. I want to say that Ho-Chunk Nation culture and traditions always been intriguing to me, and I always have a desire to learn more and compare with the roots where I come from. And I feel like working with the tribe for so long, I adapted some of the tradition in the community, and I feel like they come very close to my heart, and that just kind of creates the environment I live in, the health of the community, and the connection I have with the tribe. So I enjoy that part of it, and I feel like that's very close to the family.
I'll go next. Can you hear me? This is Wendy. I am very involved in my community, and no matter, if it's church or helping a family spiritually, just being there for support, I'm always helping somebody with resources or getting them diapers or giving them a contact name throughout the tribe or just this area, Sauk County, because I was born and raised here. So it even though I only work 8 to 4:30, I still work every day of my life.
I'm just going to pop online really quick and answer Nadine's question. So Nadine, for your question that you have in the chat, if you could just reach out to one of us individually, whether that's me or one of the PHWs or the nurses, we can look up and see if your great grandson has received a car seat from the program. And if not, we can get you a car seat.
Would anyone else like to speak to a way that you bring public health into your daily life?
I can. I'll go next. For me, as I started this position, because it's a new position for me growing up and then just taking a new challenge, I read over tons of material for public health in the position I sit in. And I was reading an NIHB material that when I started this role, Bridge for Future Generations by integrating indigenous knowledge with public health practices. You are helping to create a sustainable, cultural, grounded future where the next generation doesn't just survive, but it thrives. And for me, having 4 kids, I think being able to use those practices that we implement and teach and develop is super crucial for our younger generation. Plus, you know, I'm able to teach that to my kids and have them excited to see where they go with it. So yeah, so work is not just work, it's home too. So yeah.
Does anyone else have anything they would like to add? Or any other questions?
I do. So I have a question for the team and possibly Nadine if she wants to answer. We have the presentation, we have everything that we talked about, our specific roles of public health and what we do for our communities. But in general, not the what it does public health mean to you, but what do our successes look like? Why do we do this work? Why are we here every day? That kind of thing. And then for Nadine, who's listening too, I thank you very much for being here, but for being here too, the same question of what does that public health work mean to you? Why do you come every week? What do you enjoy learning? But just that question for the team in general is just why we do the work that we do.
I love working with teenagers. They always have the most crazy questions that they're too afraid to ask their mom or their dad. But I am this person that I'm a nurse, I'm safe. They don't know what I look like. I don't know what they look like. So it's a safe environment that they can ask all the questions that they've been thinking about related to sexual health or reproductive health or school. And I don't tell their mom and dad, right? So it's a safe space that they can get any and all questions answered. And that's my favorite part.
I can jump in next. From the leadership side of things, the reason I show up every day is because of this entire team that's on here. They got to share a little bit about all of the work that they do. There's a bunch more stuff that happens behind the scenes as well. And one person can't do all of this. We need a team to do it. And so I'm able to show up and see all of the amazing things that they're doing and help support them in the process, whether it's budgets or making sure they have the supplies that they need. It can be tough being on the administrative side of things and not always getting to do all of the fun interactions, but we have people in the right positions doing it. And so it makes every day just a little bit brighter and hearing the wins of each individual.
This is Lena. I can go. My wins are just the way people express themselves to me. I feel that anytime that I don't know anything, I try to still help assist and let them know, like, yeah, I don't really know, but I'm here to help. Whatever I can do um, to help in any way. I've always been community involved. I was in Head Start groups for 12 years, policy council and everything else. Always involved, no matter what I could do. Did our community building, Halloween parties, and I just love it that our community comes together when we need to, and it feels good. So I just always been a person of help, and I feel like I found my position here during COVID because I was in other positions within the nation for a long time, and like regulatory side. So I feel like I'm more of a hands-on now, and I appreciate that.
I can go next. There's a lot of positive things about this job, and sometimes I can't find the words to describe why I'm doing what I'm doing. Um, I think the core part of this job is I feel good helping families, helping other people. I encourage healthy living, positive outcomes. Look, if somebody's succeeding, it always feels rewarding to me, and I feel like it's a big drive. Being in public health also is interesting to me because I can look at the problems in a very further away perspective, and I can kind of analyze things not just from one core place, but look at how it affects all of us. So to me, that's interesting. It's rewarding. It's never ending, and just having a good team and working with everybody, understanding how everybody else taking it and sharing their thoughts keeps me going every day.
Would anyone else like to share? In the chat, I like to stay in contact and participate in general healthy lifestyle programs. I always look for new ideas, new alternatives. I frown upon Western medicine, and my doctor knows this. So I'm always looking for alternatives. I have a food eating program, so I'm always looking to overcome that. I love to eat, but it's not healthy to overdo, and especially at my age. So keeping in contact keeps me moving in the direction I want to go. That's great. I understand food is amazing.
Did anybody else want to answer my question before I answer? Here's a chance. Go ahead.
Some major wins that I've seen so far since being here in February is the sense of community that all the events bring, specifically like the elder feeding events. Those bring so many people together, and I feel like community is just super important to stay connected to each other, but also like to know that you're not alone.
My win for the position I have is helping our community members that are in need, being there for them, supporting them, encouraging them. And I mean, I've pretty much done this my whole life, so it's even more so that I can do it as my job that I truly really love. I do.
All right, seeing no other takers, I will share a little brief history. So I took this position 100% honestly 5 years ago because I needed a job. Post-COVID, I stay and I do the work because of my staff. I love all four of the ladies that I work with. I love everyone on the team, to be honest. But really, it's my staff. I love seeing the work that they do in every one of their communities, and it's individualistic, right? We are not repeating the same programs, the same work from Nakusa to Baraboo to Meta Addison to La Crosse to Black River, Wittenberg, everywhere that we cover. You guys make it your own and you serve your community to its fullest. I just get to be the person in the background that is ordering the supplies and making sure that you have the support and the policies and the advocacies that you need to support and serve your communities to the fullest. And I thank you guys every day that you guys do that. I never question the work that you guys do and the support that you guys give to your communities. It makes my job a lot easier. Being in the position that I'm in, and I get to fully enjoy being by your guys' side and supporting you with every event that you guys come up with and figuring out a way sometimes to spin that public health viewpoint on it so that we can do it and we can accomplish the needs and asks of our communities.
Is there anything else anyone would like to discuss? Any questions? Any general comments?
Macy would like me to share for her. Her mic is not working. So she says that she finds working as a team and knowing we do the best we can for our communities is very rewarding.
I think that is a great way to end our session today. Nigigi, everyone, for joining us, and to my teammates who helped present with us today. And a special thank you to Samantha, our intern, for creating this slide deck for us. It's very much appreciated. As a reminder, this session is recorded and will be available on the Department of Health website and our Facebook page. And we look forward to seeing you next week, Wednesday, April 15th. We'll be joined by Selena Lemieux, behavioral health clinician, celebrating National Alcohol Awareness Month and preparing us for our upcoming Sober Prom, Dancing Through the Decades, a Sober Celebration, which will take place Saturday, April 18th at the House of Wellness from 5 to 9 p.m. We hope to see you there. You can use the same link as today to join all future sessions. To add the recurring WebEx link to your calendar, please email Jamie and I, and we will forward you the invite. And I will put our emails in the chat. So thank you, everybody. Have a great rest of your day.
Have a good day, everyone.